welcome to the way long overdue 4th episode of On the Block with Bryce. I'm your host, Bryce Castle, and between a brutally time-demanding job and a few equipment malfunctions that needed to be fixed, it's been very hard to find time to sit and record the show. However, I'm happy to announce that the equipment is up and running, and I have found some time to record this show's very first two-parter. Hitting up the block today is someone who will hopefully have made the wait worthwhile. She is a nurse of 11 years who has worked in nearly every department a nurse can and has many stories, opinions, and experiences to share. In this first half of our two-part conversation, we discuss the day-to-day functions of a nurse, the many different ways in which nurses perform their job, the differences between county and corporate hospitals. We take a comedic turn when we hear some of the most insane patient-related stories, and we get into some very dark territory regarding the shadier sides of nurses who abuse the system, and much worse. For purposes of her own job security, as well as to shield her from the potential blowback from any folks online or in the workforce who still feel the need to ruin someone's life over having different opinions than themselves, her identity has been kept anonymous and her voice altered. The conversation, however, is very real, authentic, and coming to you from someone who has worked right in the thick of the topics we'll be covering for over a decade. Man, it feels really great being back on the air. And now, enjoy part one of this very special two-part show. Good morning.
Good morning.
How's it going?
Amazing.
I'm really excited that you're here.
I know.
We've talked about doing this one for a while. And now we're doing it.
I know. I'm
I could not
super
be more
excited.
This episode is not brought to you by, but is being fueled by Bullet Bourbon.
Yeah.
I have coffee with Bullet in it. What tea are you drinking?
I am drinking vanilla chamomile and peppermint.
With some Bullet Bourbon.
With some Bullet Bourbon.
Well, my friend, cheers. Cheers to this amazing episode.
Yes.
All right. My nurse friend shall remain anonymous.
Yeah, I like that. Anonymous.
We have a lot to talk about.
Way too much to talk about.
This is such an exciting show today.
Yes.
Well, you're going to just open the door and open our eyes on all sorts of shit. So
yes.
I'm really, really fucking excited about this. Okay, so first of all, you are a nurse.
Yes.
How long have you been doing this?
This is going to be my 11th year. Next month, actually, in October, will be my 11th year of being a nurse. Within that time, I have done and worked in various places. I have worked for county. I have worked for very big corporations, very big hospitals. And right now, I'm currently working in an oncology department.
Oncology, what is that?
Oncology is cancers. So all types of cancers. It could be liver, breast, everything. And we treat and we do research in my department.
Research too?
We do research as well, yes.
And who's doing the research?
The research is conducted by a research team. So we pretty much do just normal EKGs, normal visits and blood draws to make sure that their studies are being correctly logged. So we need to, and medication, obviously, that they're taking to see if the treatment is working for that particular cancer.
So your day-to-day is a little different than a typical
nurse.
Yes.
Right now, yes, it's mostly I've been working with a lot of breast cancer, and then for a couple of other patients, it's a little bit more difficult, but for the most part, it's a lot of breast cancer.
So, what is your day to day like? Like when you clock in, you clock out. What's a typical? Not that the medical field gives you typical, but like there are certain routines I'm sure you go through day to day. What's that like?
So for us, it day to day, it really does vary. We have research patients certain days of the week. So those are the typical days that are the most stressful, which I have definitely mentioned to you.
Yes, you have mentioned a few things.
Very, very stressful. Research days, pretty much we do blood draws. We just make sure that medication is being taken at a certain time. We monitor their EKGs while they're on the medication until they are done with the course of the medication. We also do injections, and on Mondays and another day, we do radiation. So every day is a very different day. However, on the days that we know what we're going to be doing, it's a little bit repetitive. But every patient is and every story is different, and that's the great part about it.
It doesn't seem like one of those jobs where it would get too routine or too boring.
Yes.
But you do have routines in there, I'm sure.
Yes.
Is there any aspect of it that does feel kind of like monotonous, or do things mix up enough where you can kind of make it seem like every day is a new adventure?
Yeah, no, every day is definitely different, even though we unfortunately get to see a lot of the same patients, over and over again. They're still all very different. And thankfully, it hasn't been too repetitive where I have to be like, okay, I need to probably change a pace where I was working before, where it did get too just similar every single day that I'm like, okay, I need to change because I don't want to be doing the same thing every single day.
Sure.
That gets boring.
Sure. Oh, yeah. With any job, that would get boring.
Yes.
Even my job, boring. Any kind of repetition can get boring after a while.
Yes.
So you've done everywhere between county and corporate and now where you are now. What are the differences? Like, my biggest question now is like corporate and county. Like, just off top, I can think maybe there's a lot of differences, but like break down those differences.
A lot of differences. So where I used to work in county, we obviously were government owned, so we have a lot of government fundings. So differences, population. Population is extremely different. We get to see a lot of transients. That's mainly what we actually treated. So it was a little bit more different. We definitely were a little bit in a dangerous area. So we would have, our medication and our lab will always have to be locked because we did have a couple instances where they get broken into. And obviously the places they get broken into is the medicine and the lab because they want needles and syringes and, obviously all the good stuff to do their stuff.
Of course.
So it was a little bit different. And then that was my first job right out of nursing.
That was your first gig?
That was my first job. I was
Wow.
working for a county. And the only thing I miss about county is that the situations were amazing. I came across a lot of really, really freaky and amazing experiences that I definitely will never, ever have to come across ever again, which kind of sucks. But no, it's and they kind of stay with you forever. And I've told you a couple of those things.
You have. Is there any that you can tell here?
Yeah. So where I used to work at county, we we would see a lot of different transients. One in particular was not a transient. She was a cute little old lady, and I love old people. I think they're so cute, and I want to adopt every single one as my grandparent. But they're so cute, and this one in particular rode this really amazing sports car, amazing. And she would always come in because she thought that she had worms coming out of her skin. So she would be, in the lobby, like scratching the hell out of her until she broke skin. And, she's like, do you not see them? Don't you see them? And we're like, we're not really sure what you're trying to tell us. So it was quite challenging. And then in the end, we finally did a talk screen and, cute little grandma was like super high on meth. So, she was just having like one of her like come down. So it was quite interesting. And she would come like I think she came in like almost every day for like 2 weeks because she was having worms coming out of her.
You had a little old lady high on meth?
Yes, and she was so cute. I was like, we have to help her. Like, there's something wrong with her. And then, like, finally at the end, I was like, damn, grandma, you beast.
So what do you do in that scenario? Do you just tell them to go fuck themselves, or do you try to get them into some sort of outpatient?
No. Yes, absolutely. We this particular one, she did come like and like again, she was breaking skin from all the scratching, so we had to keep her isolated, absolutely, because we can't have her, touch everybody. Right. So we have to have her, isolated, and we did call, at that, what was it called? It's like a mental health specialist, but there's like an actual word for them. So she came in, did a whole bunch of questions, and she had to be admitted for 72 hours, have a 72-hour hold. So
that's what I was going to ask, because somebody who comes in and starts talking about things that aren't happening, yes, or starts self-diagnosing things that aren't there. Yes. Obviously, there's only so much you as a physical medical, yes, professional can do.
Yes, absolutely. Absolutely. So it was, so they had to do a 72-hour hold. And then, obviously within that time, she was getting detoxed, obviously, because, she was not getting anything. And depending on the drug that you're doing, we have to counteract it. Some. And then some, your body just has to have to go through the changes of not having it. And it's quite brutal, which I did have in my profession, I have been lucky enough to work literally every department. Oncology probably is the last department that I have not worked on. But I did women's health, and I did OBGYN, and I had a midwife that I did a couple home births with. Whoa. So I have literally done amazing work in my 11 years of almost 11 years of being a nurse. And I had a patient who was pregnant and really young. She was a really young girl. And she was not able to function or move if she did not shoot up heroin right at the beginning of the day.
Holy shit.
And when she came to us, she was already 6 months pregnant. However, she was a very small, very, very small, very, petite girl.
Like
and
how small?
Like she maybe weighed, I think, 102 pounds.
Oh
and like
God.
5'2", 5'3". So really small.
And she's pregnant and doing heroin.
And she's pregnant and doing heroin. And we could not even see that she was pregnant because it just looked like she was only maybe about 3 months pregnant when she was already 6 months pregnant. And
was the baby all fucked up?
The baby, I stopped working at that particular place once she had it. So I'm not really sure. We do know, because I did the paperwork myself, that the baby was going to be taken away right at birth. So once we have a pregnant patient that comes in, we do a whole bunch of tests right at the beginning. So we draw your blood, we do tox screen, we do to see if you are, your antibodies, your blood type. So we do a lot of testing. Obviously when the tox comes back, we have to report that to, whatever hospital we belong to, which is ultimately where the mom will be giving birth to. So all that information is, sent off. And then within that time, we do regular tox screenings on patients who have come back positive, though. Not on everybody, just who has come back positive. Just to make sure, what their levels are, if they're still really high, if they're kind of coming down. Like it's just a lot of things that we have to do. So, and everything keeps, being logged and recorded to obviously to make sure the mom is obviously healthy, but most importantly, the baby. That's our number one concern when we have OBGYN patients. The baby is our number one concern.
And this was all county work we're talking about?
This was all county work. This was a different job. But no, county was the best. County was way too scary, way amazing. It's quite interesting.
Okay, so that was county. What's the corporate sector like as a nurse?
The corporate sector, you get a lot of perks. That is one thing about working from county to a corporate office. Yes, county does also have, great perks, but, when you are corporate, it's a lot more. You get a lot more incentives. You get a lot more, for example, the one that I work at right now, they offer nurses, a lawyer, and only because, nowadays it's getting to the point where you can sue just a nurse in particular and not the whole system how it was before.
No shit.
So, you have to have, and they even tell you, like, if you want to have a lawyer on your own and on top of what we have, absolutely. They give you a choice where you can do that. And unfortunately, it has come to the point where a nurse themselves will get sued rather than the company.
Do you get sued for malpractice?
It could be for malpractice. It could be, for a lot of things. It could be sexual harassment. So obviously they're not going to go against the whole company when it was just one particular person who went at that person. So it just really depends. So it's not just malpractice. It could literally be for any little thing.
Sexual harassment at a hospital?
Yep.
I mean, I can kind of see where somebody could low key, because of their profession, be like, oh, I'm just quote unquote examining you. Yeah.
Yes.
But I would imagine that doesn't happen as often as maybe people would like to make you think. If they're making you think that way at all, I've never thought about that. And I have a dirty fucking mind.
I know you do, you creep.
But that's what I mean, though. Like, you've seen porno like that, but you don't ever go in there thinking that's what's going
to happen.
Right.
Yeah. Yeah. And unfortunately...
Because do nurses have to take the same type of HIPAA-related oaths as doctors?
No. They have a completely different one than what we have.
But they do have one.
Absolutely.
Run that down for me.
Oh my gosh, why? I don't even know it all anymore. It's been
just like general outline. We're both drinking water now. Yeah.
The only thing that it is like pretty much for sure is no harm will come to the patient, under your care. That's pretty much for sure. Like, and that you're going to be treating them with, good care. And, unfortunately there are nurses who do not provide that care. And,
Sure.
I myself have witnessed a lot of those things. So, and not just in county, also in corporate, I have noticed, sometimes nurses feel like they have more power. And unfortunately we do. Because,
right.
Some doctors, I'm not saying all doctors, because I currently work with some amazing doctors who literally do all the job. Whereas before I've had, I'm the one who does everything. Anything the doctor does is just goes in, says a couple words, signs off what he needs to sign off, or she needs to sign off, and then you're on to the merry way, and we take everything else after that.
Well, I think that's the thing that most people notice when they go to a hospital.
Yes.
Not so much maybe a doctor's office, because obviously that's the doctor's office.
Yes.
That's where he or she is doing their thing,
Exactly.
practicing medicine, taking
Exactly.
care of their patients. But at a hospital, you're more likely, I found, talking to a nurse or a nurse practitioner
Yes.
than you are the doctor.
Yes.
How involved are doctors in the day-to-day work that you do?
And where I'm at right now and where I was before, because they were both, one was private practice and this is more corporate. No, they are extremely, extremely involved. I feel now my role as a nurse is just the basics, just vitals, and then injections and like other things like EKGs and blood draws. Obviously, that's stuff that we do. So more nursing stuff for me is actually falling into the nursing role rather than being a nurse / doctor.
And this is compared to county, which...
Oh, yeah, absolutely.
You
When
almost never see the doctor.
Oh, no. Yeah, no, you never see the doctor. It was always just us. They would just be like, oh, hey, you're fine. They're going to come and do this or do that. But we triage, we do everything. And it's, we just pretty much need the doctor to just kind of pop in and be like, hey, I'm present.
What's the reason for that in county compared to corporate?
We, like for us, like for example, in county, we are not doctors, so we're not allowed to sign for certain things.
Right.
So the doctor needs to sign them for us. So that's pretty much the only thing. There's certain things that, and only because of the computer system. It's not anything to do with anything. It's just really, if you're not a doctor and your license in the system does not show that you have a license to sign off a particular thing, you won't be able to do it. So the doctor needs to at least show, hey, otherwise when you charge it to the insurance, it's committing fraud if you really didn't do anything for the patient.
Sure. No,
So
I
that's
get that.
basically the only thing.
In county, it seems that the doctors are stretched pretty thin because you have a lot of people going in a lot for a lot of different things. Is that really why you don't see the doctor a lot in county? Is just they have so much shit to deal with?
They do. And they do. They, where I was at, we would have by 6 a.m., mind you, we open at 8. By 6 a.m., we had maybe about 50 people already lining up to be seen by county because we can only take so many patients.
Right. And how many doctors are on call at any
It depends.
time?
Sometimes I was stuck with 2. Sometimes I was stuck with 1. So it really, really depends. So you could just imagine having one doctor to see 100 or so patients in one day. It's just, it's possible, but not possible with the time frame that they give us.
Does that, in your opinion, harden those particular doctors who have to work in those situations? Because the vibe I've always got in the rare times I've been to county type hospitals and whatnot is that they're kind of absent. They're there, they ask a couple questions, mark a couple things down and be like, all right. It's almost like they're saying, fuck you. I'm not saying that they are, but it kind of gives that feeling that they are. And is that something that just is a side effect of having to see so many people with so many problems and you really can't do anything?
Absolutely. And we have come we did have to limit what you're coming in for if there's only one doctor. For example, when I had just the one doctor, it's like, hey, you have 4 problems. What's the main one you want to be treated for?
Right.
And it's not that we don't care or we can't treat you. It's just we also have 80 other people that need to be seen. So it's not, I don't want to say it's like a fuck you, but I can kind of see where you would come from because it's like, hey, a nurse is telling me that I have 4 problems, but I can only be seen and treated by one. So then I have to make another line and then get treated for that other thing that I need to get treated on. So it's kind of, it is a little bit fucked up when you have to limit, and it's fucked up for the doctor because there are doctors and nurse practitioners and, PAs that really, really want to help every single problem that you have. But because of the time and, you are the only person on staff, it's just physically not possible.
I would imagine
that's
not,
where
no.
I see that I can see the doctors that are like, oh man, this poor person had I really wanted to spend extra time and, I couldn't. And then there are some doctors that are like, no, it's, and it's not really because they don't want to help or because they can't help, because they don't want to help. And you will see doctors that are like that. You can see doctors that are just here for the money. You can see doctors that are just like, okay, fine, I'm just here to write off 30 Percocets because, it's just to shut you up and, get you on your way. And unfortunately, I have worked with doctors like that. Patients come in, hey, I want 5 Percocets because I ran out. They don't ask, what are you taking it for? What's going on? And it's like, dude, your license is what's at stake here. Some doctors will be like, well, I know this person. I know what they're using it for. okay, yeah, I can see, again, it's your license. You're the one who's deciding to do that. For people who have licenses and definitely have worked really hard to get those licenses, definitely take it a lot more lightly. I feel like if you kind of just are just there like, hey, whatever, it's like my last years before I retire, or like I'm just whatever they want to pay me, it's just whatever, you'll see the differences in care.
Right.
Like you'll see a lot of differences. But county has been or was really, really interesting for doctors to see. I did see a lot of doctors burn out because of the same thing.
Well, I would imagine so. So people who go to the county or like the ER, for example, a lot of it, let's be real, is bullshit. A lot of it's bullshit. I remember one time I cracked my head open. I had a concussion. I'm bleeding. Nice. I needed stitches or staples, one of the two.
Nice.
And I'm sitting there in the ER. This was a work-related thing. So, like, I fit the profile of somebody who should probably be seen right away. And because it was a work-related thing, you're not going to have to ask a million billion fucking questions to see how it's going to get paid for, et cetera, et cetera. And I'm sitting there holding blood on my head next to people who sneezed funny, and they're in the ER. So I can definitely see where doctors burn out. But for the doctors who, as you mentioned, are on their last couple of years or just there for the paycheck, is there certain things that you can kind of tell when you're meeting a new doctor, like how it's going to be? And is there anything you do to prepare for it on your end?
It just really depends. When I worked at county, we never really got introduced to the new doctors or anything like that. It was just like, hey, there's someone who's going to be coming here, like let them in. And when I worked for corporate, my last job where I worked, we did have a new doctor that actually did come in on staff. And she did our round at the where I was at, and she introduced herself to us. So it was easy for me to at least like kind of get a feel where we were going to be at.
Right.
I couldn't tell much about her because obviously you can't really tell much about her. However, her work ethics is where I saw it.
Right.
She was she came from I think she came from Utah, and I don't know how they did it over there, and she obviously she was at a private practice because it was her own practice. Her nurses were trained to what she wanted them to be like because she trained them. Mm-hmm. However, we obviously were not trained. And so, we couldn't work how she wanted. And she would always throw it in our face, well, my nurse is this and my nurse is that. And it's like, okay, yeah, I get it. I just met you like last week and I don't know your protocols. Like you have to be more verbal and tell me what is it that you're looking for me to be able to do my job at what you want it to be. Where I was working at, I had 4 other doctors plus her that I had to work under. So it's not like, and they don't all work the same. They all work very differently. They all like their patients to be certain setup and, be in certain ways. So it's, I have, if I don't know how you work, I can't function how you want me to function for you if it's not what, and yeah. And she was very, very dirty, and unfortunately there's a lot of doctors that do that. And I'm not saying dirty as a person. What I mean is dirty as a professional. She would leave open needles. She would leave open scalpels and, not in the discharge container. It will be out in the open.
What the fuck?
And when she would do pap smears, there will be blood on the floor. And it's like, okay, like, what are you doing in here? It looks like something went off. And I have pictures that I can show you if you want me to show you.
Well, no, I believe you.
It was quite gross. And it's, those are the things. It's like, you can prevent needle sticks. However, you shouldn't have them hiding in plain sight. Like you're just causing them to get like
that's
needle sticks. I've been like in this profession for 11 years, and knock on wood, I've never been like needle pricked, which is great. It's a lot of nurses, you do, and it's you have to go through a lot. I worked for this amazing urgent care. I love this urgent care. It was great. It was in LA. That's all I'm going to say because there's like only one. Mm-hmm. And it was amazing because I was able to see so many amazing cases. That was by far my favorite spot. And when I had to leave it, it was really hard for me to leave it because every single day was just way different cases. I've had people come in with their fingers shredded. I've had people come in with like big head wounds. It was amazing. And I really, really missed that one. If I can go back and like just even not even get paid for it, just go because of the experience, I would totally do it in a heartbeat.
So you see a lot of amazing shit.
Mm-hmm.
I'm pretty sure you see a lot of bizarre shit too.
Oh yeah, absolutely.
All right, what is the most bizarre, insane fucking thing you've ever seen?
A guy who was in prison had gotten out, and he shoved a marble in his penis.
Why?
The story.
Holy
what?
fuck.
And again, this is county. This is where county was. It was quite interesting because it's amazing. But anyways,
Jesus.
and the thing is, and then before you ask, this person was paralyzed, so they were not really able to feel as much as the pain, like as needed. So this guy, was in prison, and his girlfriend, who was pregnant, at the time, whether or not that's the father, I don't know, and I didn't want to ask because that's just too weird.
Well, that's a whole other conversation.
And so she came in, she was like, my boyfriend has been bleeding, like it's just hurting all the time. And I'm like, okay, what's going on? I'm like, I'm going to step out, go ahead and change and I'm going to come back in. So usually, by the way, we always either ask the patients if they want a chaperone in the room while we do any private scary stuff. There's some people that do, so I asked, hey, do you want like a male to be in here, with me? And, he was like, no, I have my girlfriend. So it was fine. So anyway, fine. I go back and then, I look at his penis and it's just like super like swollen and like red and like inflamed. And I'm like, okay. I'm like, in my mind, I was like, what the fuck happened? And I'm like, Jesus Christ. I was like, why did I come in this room? and then the other side of my brain, I'm like, holy fuck, this is totally going to go down in my memory is going to be like in the history books for me. I'm like, So it's like I feel like there's always two types of nurses. There's a nurse that's like, okay, like I really like nursing and it's like whatever, good money, whatever. And then there's weird people like me, like, yes, let me drain everything you have.
My sister's that way in her job.
Yeah.
She's a dental hygienist.
Oh, those are
and
the
like
best.
all the tumors, all the things.
When
She's
you
just
drain,
like, I want to drain that shit.
Yeah.
She's
and
so into that shit.
I just did that to my boyfriend because he had like this really awesome thing on his leg, and I like lanced it, and it drained, and I was like, I felt like relief. Everything was right in the world after that.
Okay, so quick side note before you finish the story of this guy
Marvel.
with the inside Prince Albert, fucking god damn. See, as a man, when you mention penis or testicle injury, I feel it.
I know.
We all feel it.
I have to tell you one of a woman, and I felt that one, so I know exactly.
There you go.
Yeah.
But let's sidetrack for a second here. As a nurse, as a professional, but also I know you privately as the weirdo, the wonderful weirdo that you are. How do you keep your game face on when you see crazy shit?
I'm gonna be honest, and this is me. I obviously, all nurses have their quirks, but for me, I just sing. Like I just kind of like play like. And I know you hate Deftones, but I love Deftones.
I don't hate them; they're just not my favorite.
That to me means hate.
Oh, okay.
So, anyways, yeah. So I usually just keep myself calm, and that's just how I do it. Because if I do, I'm like, oh my god, and I would just be touching right away.
What the fuck is that?
Yeah. So I'm just like, it's you. Yeah, that's the hard part. The hard part is like keeping your game face on it.
Well, that's got to be hard.
Case.
Like especially if things just like happen.
Yeah.
Because I was at your house a couple weeks ago.
Yeah.
And one of your friends told a story about how just like blood sprayed everywhere. And as a professional, I would imagine you would have to definitely keep your game face on in that moment because
you can't be like, oh my god, ew, ew. Yeah.
Right, but internally, you might just be going, what the fuck is happening?
Yeah.
How do you do that? Is that just 11 years of training? Did you start that way? Have you always been able to keep a straight face?
For me, I did have a really bad case of RBF because I was with a person that made me get RBF.
Wait, what's RBF?
Resting bitch face.
Okay, resting bitch face. I just wanted to make sure it was what I thought, and not like a medical term we didn't. No. Yeah. Okay.
No. So I definitely have a really, really, really bad case of RBF, and unfortunately, like my friends who are close would tell you, like, yep, that's why I had like a really good game face. But honestly, I'm gonna be honest, it's really the adrenaline. Once you see something that you don't know and you're not waiting for it, your adrenaline would just start rushing, and there's just no time no time to make mistakes, but no times that you don't know where everything is and you don't know what to do at that specific time. There's like once, for example, I this job that I have now, they do simulations. Okay. So we have a training week where it's literally simulation. So they have actual people, actors that pretend to have like actual medical things, and you walk in with the scenario already happening. So and everything is kind of set up where it's actually something is actually happening. So you as a nurse, your instinct is just to go help, and you already know what to do at this point.
Okay.
Once you've already been in this field, like how long as I have, you already know what to do. For someone who's just starting out, when I started out, I did have a couple of cases where I had to be on my game, but because you already know what to do at that specific scenario, it's easy for you not to be freaking out. For me, I can't say that for all nurses, because we all react the same. But the more experiences you have, it's really hard to get into that, like, oh my God, I don't know what to do. No, it's too hard.
Well, not so much I don't know what to do, but just like, holy shit.
Yeah, like, holy shit. Yeah, like, I feel like at that point, you'll have to see something that, probably like a unicorn having a baby or something.
Right.
Like, to be like, holy fuck, like, damn. It's like, no, you'll probably, like, that's how you'll get after the fact.
Okay.
That's how I see it now. Like, I don't see it when it happens or when it's happening. After it's like, fuck, like, shit, like, fuck, that just happened. Like, that's just what happened. Exactly.
Okay, so getting back to the guy with the marble in his dick. What happened? So you get there, it's all swollen,
yes,
it's all gross.
Swollen, it's super infected.
The girlfriend
it's
is there,
you know,
she's pregnant with maybe his friend's baby.
Yeah, you know, because he was in prison, so who knows. And again, he's paralyzed, so not paralyzed like, you know, down there. Down there, he's still okay.
Okay.
That particular function is still okay.
Does that still function with most people who are paraplegic?
It depends. It really depends. I've only come across a handful, but then again, I've never really had a lot of those kind of patients that I can say that.
And can they feel it when they're having sex?
I've never had that question asked, and I never asked a patient before. Not that I didn't want to, but just professionally, you're not allowed to.
That's it. I'm gonna find the guy in a wheelchair. I'm gonna bring his ass in here, and I'm gonna. It'll be a 10-second podcast.
Yes, because I definitely want to
When
know.
you fuck, can you feel it?
Yeah.
Yes or no?
Me.
Podcast over.
I know. Like that's all I want to know. Because I have obviously wanted to know, but it's like you can't ask because it's like. It's too rude. And
no, I wouldn't ask. I would imagine you can get in trouble for that.
Yeah, no, you could lose your job. So it's just, you know, obviously you can't. So unfortunately, I don't know.
Okay, so the guy's got the marble in his dick.
Yes, so he has the marble. And obviously, we have to ask questions. Like that. I feel like that's the one thing that we need to have people know. It's like, I don't want to say 21 questions, but it's definitely like, we need to know the answers to the questions.
Like, how the fuck did that get there?
So obviously in my head I was like, what the fuck did you do? And like, how? That's my main question. How? So anyways, you know, I asked him, you know, like, you know, so, you know, what's going on today? And, you know, in my head, I was like, Jesus Christ. I was like, please don't get up.
Why does your dick look like that?
What is going on? Like, what happened? So, and then, you know, obviously I'm like writing down like what he's saying. Cause back then, where I used to work at, the county that I used to work at, still had paper charts.
Okay.
And kind of towards the end is when they started to become, you know, through the computer and whatnot. But anyways, so I was there, you know, and I'm like, I don't know about other nurses because I've worked with other nurses and they like to be mute like the whole time, you know, and that I'm a talkative person and, you know, that I love to ask questions.
Right.
So obviously I'm asking the questions as I'm trying to clean, like, you know, what's going on there. And, you know, obviously it's a little bit, you know, weird for the person, for my patient, because I'm trying to hold the conversation here. And, and then he ended up getting an erection as I'm talking to him because I'm obviously cleaning his fucking dick.
But he's got a marble in his dick.
And then, yes. And then, so then I asked him, I was like, oh, you know, so like, so what's going on today? And then he's like, I'm coming in because, you know, I think my penis got infected because I put a marble in it. And I'm like, oh, my sweet baby.
How do you
Jesus.
How do you get an erection with a swollen, infected marble?
That guy, I'm telling you, that guy was an MVP because I'm like, bro, if that would have been any man, that would have been like, just take the shit out. Like, just take the shit out.
So I'm not one of those guys who can get an erection in an uncomfortable, painful situation.
Most men
it's
can't.
Not me.
Most men can't.
But that guy had to be some sort of fucking true, you know, and he's paralyzed.
I know. I'm telling you, that guy was a real MVP.
That probably is his baby.
Yeah.
He probably got her pregnant from like across town. Like he probably just willed that shit and it fucking happened.
And then and you know, it's so funny because we're at county, like people don't like to take like, there's people who don't like to take male patients.
Can you do me a favor and either move the mic or
me?
Closer? Yeah.
Okay. So people don't like to have patients that have like their own wheelchairs because, you know, you have to do extra for them. I really don't care. It just doesn't matter. It's just, you know, a patient is a patient. You're there to help them and treat them. And it's just, you know,
is what
send them
it
on their way. And then, so everyone's like, where I used to work, there was kind of like a border, and like it kind of showed you like, hey, person here, whatever problem.
Right.
Anyway, so like I'm like cleaning him, and then I'm like, okay, so what's going on? Like what happened? What's going on? And he's like, I was in jail. I just got out a couple weeks ago, and then my girlfriend sent me this letter earlier that she had seen this on, I don't know if she saw it on TV or on porno. I'm not really sure. I can't remember because it was so long ago. But she wrote me a letter that she wanted me to stick the marble in my penis, and I'm like, and this was for, and then he's like, oh, for her to have a different sensation since I'm paralyzed. And then I was like, in my head I was like, but you're having an erection, so I'm pretty sure that will suffice. I was like, I'm not really sure like what else women need inside their vagina besides like something that they want.
Don't they have toys for that anyway?
Exactly. And then I'm like, okay. And he's like, so I had one of my buddies who like helped me shove it in, and I'm like, who is your buddy? And was he sterile or wearing gloves at all when this is happening?
Could you imagine that fucking conversation? Hey, yo, bro,
homie.
What's going on? Not much, dude. Hey, listen, I need you to do me a favor, dog.
I know.
What you need? All right, so I'm trying to fuck my girl, right? And she wants to feel something a little. I need you to come through. Look, I'm just gonna be real with you, dog. I need you to come through. I need you to shove a marble in my dick. Like, how does that conversation go down?
I don't even know how do you even do that. Like, I don't know. I'm telling you, I'm like, I wish I would have known you when you were in prison, aka I would have like probably put like a bodysuit or something. Because I'm like, I want to know what this guy said to you.
What the
fuck? What did this guy say to you? And then, obviously, you can't ask those kind of questions. It's just like, I mean, you could, however, you risk a lot of things.
Right.
But I'm like,
so
I'm like,
his what kind of?
It's a good friend. It's
either a good friend or a really bad friend. Because
I don't
friends
know.
don't let friends shove things up their dicks.
No,
that's what I would say.
I would have been like, no, dude, this is just a bad idea.
Hey, bro, I ain't getting involved in your
over.
sick, twisted Prince Albert internal fetish.
It's really weird.
That is weird. Okay, so his friends helped him put the marble in his dick. Then what?
Yes. And I did hear from the girlfriend because I did ask. That was one question I did ask. Did it actually feel different, or did you feel anything? Was it not was it worth it? But in my head, I was like, bitch, was it worth it?
Like, bitch, I gotta know.
Like, what the fuck? And then she's like, it actually felt really good. I was like, I'm done with you. I'm like, I'm done. I'm like,
again,
I can't.
For that.
Yes. So we ended up having to. We obviously had to put him to sleep. Like, it was just we had to drain like the blood, obviously, because there's a lot.
Where do you
of
cut
blood, like
when you drain it? On that particular part of the body.
On that particular, you have to do it like on the shaft. You have to
bottom,
on the
top,
shaft,
side.
Kind of like top-ish.
I would imagine the top's the only place you could without nicking something.
Yeah,
important.
exactly. So it's just the top-ish. So we drain, and then we had to do an incision, obviously, like where the marble was, and we took out the marble. The marble was like,
what color was it?
It was a blue one. And in my head, I was like, blue ball.
Yes,
I was like, OMG. I was like, oh my God, I'm done. I was like, this is just too much. I was like, it was hilarious. So the marble was all like, I don't want to say crusty because it's not, but it was like all full of like weird like fluids and stuff like that.
Yeah, because your body's
and,
attacking it.
Yeah, so it was really gross. It was the best. And I remember we had to send out the marble. I was like, just keep the marble and just like
what happened to the marble?
Sanitize it. No, we had to send it out.
Oh
no, I know. And I would tell you the truth. So no, we had to send it out.
You would have shown me the marble if you had it.
That I would have kept it if I could. I would have totally kept it.
Look at the guy and be like, yo, can I keep this?
I would. I wanted to, but you have to have the fucking protocols.
Jesus
That's the only
Christ.
thing I hate about like protocols.
I heard a story one time of a guy who got a plunger, like the handle of a plunger, stuck all the way in his rectum.
Yes.
Because he was using it, I guess, to masturbate.
Yep.
But he stuck it on the bottom of his bathtub and was grabbing
to, like,
on.
suck pretty much.
And he was grabbing on to the shower curtain for leverage, and the curtain gave, and he fell all the way on it. But he couldn't get up.
Yeah.
So he actually had to have someone call
911
for him, and then they came and found his ass literally stuck to the fucking porcelain of the bathroom floor and the
Oh,
plunger.
fuck.
Explain that one. Like, how you explain that to a fucking paramedic? Like, so
I have.
I was showering and I slipped and like, what do you
Like, I
say?
fell.
Yeah, what do you say to that?
For me, I think I would have been like, I don't know how this happened. It just happened. Like, I'm not really sure, but it is medically possible for it to be shoved in and just through the rectum, and it is possible.
Yeah,
however,
but you have
just
to be putting
say it
yourself.
and explain it.
You'd have to put yourself through a very specific set of circumstances to get that there.
Yeah.
That's just like those guys who masturbate at the bottom of the pool where the drain is, and then they jump up and their intestines just trail out. Yeah.
Yeah.
How do you explain that other than, all right, doc, I was jerking off in the bottom
Yeah,
of the
like
pool.
you just. I mean, honestly, I feel like for me, men have been always very blunt, very true, and very like honest with their actual situations.
Oh,
Women,
that's
on the
so
other
embarrassing,
hand,
dude.
Women, on the other hand, I feel like the ones, I don't want to say lie, or they just stretch the truth what it really should be.
Well, like what kind of lies?
Okay, for example, like I had one, like, you know, with her mom. The mom was like, she's never sexually active. I don't know how she got pregnant. You know how she got pregnant.
Well, there's only one way.
You know how she got. It wasn't the Virgin Mary, girl. I can tell you that right now. It's just not possible. So women definitely do lie a lot more on how. And honestly, I feel like it's to the nurses. And then once, you know, when I tell them like, hey, the doctor's not going to come in because it's not that they don't want to or they can't. It's just, you know, that's what they have us for, pretty much. If it's something super treatable, something like you come in for a pregnancy test, why are we going to bother the doctor? Hey, you're pregnant.
Right.
So it's just certain things that we just don't involve the doctors, and that's per protocol. It's not because we can't. That's what our protocols are for, you know, our specific areas. So we follow, you know, what we're there for.
Sure.
So you know, the mom, she was adamant. She's like, it's just not possible. She's just not. And I'm like, okay. And I'm like, okay. At this point, we do involve the doctors, and only because there's certain things that we cannot do. So, you know, we had to do a pap smear, and then I was there to pretty much just chaperone to make sure the mom wasn't going to say some bullshit that, you know, whatever.
Right.
So at this point, they cannot refuse a chaperone. Once because the mom's like, no, she's like, I don't want her in here, meaning me.
Okay.
And my doctor was like, she's in here for me. And then, so at that point, you can't really do anything. They can request another nurse. However, they don't want to wait 3 or 4 hours for another nurse to be available for them.
It's so weird that women lie.
And then it's just, you know, in this particular case, she did the pass-through. She's like, you know, just to let you know, the walls look like, you know, it's easy for us to tell whether you've had sex, whether it has been rough, normal. It's easy because you're trained to do that.
That's fucking nuts.
You know, and, you know, we did tell her like, hey, you know what, like,
sorry,
had sex. Like, I mean, what else you want from us? Like, it's just like, you know, it's just, it is what it is.
Was she underage? Is that
she was? I think she was like 14.
Oof.
So she was really young.
Ooh,
really,
that's
really
rough.
young.
Yeah,
so
no
she
parent
was
wants
really
to hear that, I imagine.
So, I mean, you know, obviously it was sucked for her, but you know,
were they like the good Christian type of folks?
The mom was.
Oh.
The girl was just, I mean,
well, obviously she wasn't.
I know, right? Yeah. Oops.
Do you get hit on a lot in your job?
I do, unfortunately.
Is this something that nurses go through on a regular basis?
I don't want to say regular basis. Like I said, right now I work in oncology, so it's kind of hard.
Right.
Like for that, however, I did have one patient, actually, I think it was last week or this past week. Super cute. Oh my God. No, like not in that way. So let me explain my patient. My patient has this amazing accent. And for people that know me, I'm like, I love accents.
Yes.
Because I don't know why. I just love them. Anyways, so he was from Argentina. And he just came in. He didn't have cancer or anything. It's just normal, you know, but kind of like a second opinion almost.
Was this an old guy?
He was an old guy. He was like in his like 50s.
What's your ratio of old guys to young guys hitting on you? Is it mostly old guys?
No.
No?
No. I've had, you know, it depends on the scenario. Here where I'm at right now in oncology, it's no, because it's, you know, obviously you're like,
well, you're dealing with people who are dying.
Yes, exactly. So it's just no. But where I was before, yes, I had men and a couple of women who hit on me. I had one in particular who wanted me to, she's like those candy girls or whatever, or I don't know what they call them.
I don't know.
But anyways, she was like, oh, you could be, cam girl.
Cam girl. Okay.
She was like, she's like, you could be one of my cam girls. And I was like, okay, homie, I feel like you're pimping me out right now. Like, it's
Watch
not
out.
even like that. And then she was just like, I think you're just so cute. And I'm like, okay, well, where I was before, I obviously wear a uniform, but we could wear whatever like uniform and print we wanted to wear.
Right.
So I would wear like, obviously like Star Wars and like, stuff like that.
Yeah, I've seen your outfits.
I know, right?
Sure.
So it's like, that's what I wore. And there was other girls who would just wear like bland colors. So I think that's kind of like the
Well, plus your personality is also very inviting.
That's true.
I think a lot of men, especially men in our generation, don't know the difference between being polite or being friendly or being interactive and actual interest.
Yeah. And you know me, like, that I'm like,
sure.
no.
Yeah.
So, so unfortunately I am one of those people who like, I'm always going to talk to you, unless
Yep.
I don't like you. And if I don't like you, it's not me. It's definitely you that has a problem because I definitely get along with everybody. So
Right.
if I don't get along with you, there's something wrong with you.
Okay. So with that said, how do you handle that? Especially in a medical situation where you do have to touch areas of the body, and some people are just kind of gross, and that's when they make their move. I don't know how a person could make their move in that scenario. Like, I got tested for a hernia recently for my current job, and the girl was our age, very cute, and I was just so like, oh my fucking God. This is the worst thing ever. And so when she tested me, like, it was like I was in a cold room. I just had nothing going on down there that would say, hey, baby, how you doing? I was just like, oh, my God, I don't like the fact that you're touching me. Yes, you're cute. I wish we could have met under different fucking circumstances, if nothing else. So to those guys, I mean, that has to be a different level of just not giving a fuck.
Yeah.
How do you deal with that? Can you tell them to fuck themselves? Can you bring in a male nurse?
You do.
Okay.
You do. You can. You definitely can bring a male nurse, or or you could just tell them like, hey, whatever, like this, it's unprofessional or whatever. I've had a couple of patients where they have hit on me, giving me their phone number. A couple of them dropped some stuff at work.
Weird.
Which is weird. Obviously you don't, or they ask like, hey, what time do you get off? We don't ever disclose any of that. And when we have patients who do that, we have one of our male providers that walks down like with us to make sure that we get to our cars at least safe. So I have come across those kind of patients. One of them in particular, he was just an old guy, like super old. Like this guy was old. He was 80, so he was old.
Yeah, old people don't give a fuck.
And I was like, and just in the way that it was happening, I was like, bro, I'm like wrapping up your disgusting like infected leg right now, and you're like kidding on me, really?
Hey, baby, how often do you come here?
Yeah, right. So like I remember I was like, for me, I'm a nurse that tells people what I'm doing when I'm doing it. I don't want them to be surprised, like, or them questioning me like, hey, what are you doing? No, like I tell them like, and I even tell them beforehand, I'm going to be telling you what I'm going to be doing with what, and whatever, because the more education they know, they can one, take care of that themselves at home.
Right.
And then two, it's just better for them to know. So I was like rapping him, and then he's like, have you ever been in a Porsche before? No, in a Corvette before. And I'm like, I'm like, no, I was like, I'm not that kind of classy girl.
Yeah.
And then, so then he started laughing, and then he's like, how about a private jet? I was like, no. And then he's like, do you want to? And I was like, I don't like to travel that much. And like, just like, you're like trying to like tell them like, fuck off without telling them to fuck off.
Right.
So it's like you kind of just let them down a little bit easy, and then he's like, the doctor that was his doctor. He's like, Dr. So and so. He goes on my boat. I have a yacht. He's like, I can take you on a yacht. I can take you wherever you want to go. And I'm like, homie, you're old enough to be my grandpa. I think a night with me, and I will murder you.
Yeah, but see, old people don't give a fuck because it's like, hey, in 10 years from now, I'm gonna be dead anyway.
And then he's like, do you have any kids? And I was like, when patients ask me personal questions, I do not give them any personal
I think that's a good thing.
And and for people that know me, I have an amazing little boy. He's amazing. He's like the best.
Right.
How much I talk about him.
Yep.
But when patients ask me, my instinctive answer is always no. And only because one, I'm not trying to hide my child, is I'm trying to protect my child.
Sure. I
So
get that.
and then because It depends, and it also depends. I feel like there are a couple of patients who and they have told me themselves, who have followed me from county to doctor to a different doctor, because they just like the level of care that I provide for them. So those patients that I have had the amazing experience to call them my friends now.
Sure.
Obviously, they know about my life, but for other people, it's like no. Like, no, I don't have kids. I'm not married, and again, only to protect, because some people really do get really personal with you, and they want to know all about your life.
That's weird. I don't know if I could.
Yeah,
I mean, you and I are friends, but
yes,
you and I were friends before.
Yes.
The whole.
Yes.
I mean, because you've helped me out on a couple of medical things.
Yes.
Which, thank you, by the way.
You're welcome.
But I don't know if I could make friends with somebody
just
as they
random.
were examining me.
Yeah,
you know what I mean?
It's just too weird.
Like if you and I had to do it now, it's a little different because we have a
Yeah.
friendship already and we know each other outside of your line of work. But
right.
Yeah. Oh man, I met the coolest person. She fucking,
felt me up.
Yeah, I got a prostate exam from this chick, and
Yeah.
we're gonna go hang out. I just don't know if I could do that personally.
Yeah.
But
Yeah.
I
At that
guess
point, it's kind of weird because it's like no, but
everyone's
there's some
different,
people
I
that do.
suppose.
yeah, they really try to get personal with you, and you as a nurse have to kind of just see and obviously it's all your calls. There's some people who are like, yeah, whatever, I have kids or whatever.
Do some nurses take to being hit on? Do they go with it?
There are some that do. I know one of my friends, she dated one of our patients, and it ended quite horribly.
Is there rules that in your line of work that say you can't do that?
Yeah, we are not. We had to drop him as a patient, and
Okay.
only because of the fact that he was, involved with one of my coworkers.
Sure, I get that.
So yeah, we do have. There are some protocols, and it's if you work for an organization, it's not to protect the nurse, it's to protect the organization.
Right.
That is one thing people tend to forget. Once you're in corporate, yeah, you belong to corporate and whatever, but their instinct will always be to protect themselves, and then if they can protect you, well, great, and if they cannot, they'll just probably fire you. Unfortunately, that is the case, and a lot of nurses probably have experienced that. I have never come to experience that because I don't like to shit where I eat.
Right.
So I'm not that I'm one of those scary nurses that are alarmist, but I do follow the rules, especially when it comes to work.
Well, that's good. So you got a lot of different nurses, a lot of different personalities. I know everyone and their mom's a nurse at some point. Everyone goes in the medical field. You get a lot of different people, a lot of different personalities, a lot of expectations that everyone does their job. But this is a perfect segue, I think. Not all of them do their job well, like with any profession.
Yeah,
and
absolutely.
When they don't do their job well, it's sometimes incompetence.
Yes.
Like with anything.
Yes.
But sometimes, we've talked about this off air, it's not so much incompetence as it is purposeful.
Yes.
So the first thing I want to ask you is, I think something most people kind of know a little bit, or at least they've heard about it. A lot of different personalities, a lot of different walks of life coming in and wearing those scrubs.
Correct.
There's a lot of medication around.
Yes.
There is a lot
Way
of
too
different
much.
medications around
There
you
is
guys,
way too
and
much.
you are trusted to deal with them and handle them and even dispose of them a certain way. Not everyone does that.
Yes.
So I'm just going to ask directly, in your 11 years, how many addicts have you seen who abuse those pills?
Yeah.
And how many dealers have you seen who sell those pills?
Yeah.
Does it happen a lot?
Yes. Unfortunately, it does, and we have this implementation. It's called Cures. So Cures is pretty much any narcotics that are dispensed by any doctor. It doesn't have to be you. It could be any doctor, pretty much anywhere that's on Cures. You need to have your license needs to actually be able to be licensed to prescribe narcotics, and only because of the fact that, again, there's a lot of people that use it to sell it and stuff like that, or overuse it. We did have a patient. He would come, for example, he came twice in 1 month. So now it has come to the point where you cannot get medications that are narcotics more than 3 months. Before you can get 3 months at a time.
Okay.
But now it has been implemented as every 30 days. You cannot get it before. You can get it after, but you cannot get it before. So let's say if your medication, today is your last day and today is your refill, you will be able to get it tomorrow.
Okay.
Because Today, it's already too early. So you have to get it the next day.
Okay.
One particular patient, he lost his medication. However, he has lost his medication 4 or 5 times.
Right.
So it's kind of easy to spot. Or they'll go to another doctor. But again, once you're on cures, no matter where you get the medication, they will find it. If it's a narcotic, it's in the system.
Okay.
So we did have this patient who went, so when the pharmacies, they also check the cure system to see like, hey, this patient is not due for their medication until next week. We cannot release it earlier. So they have the same, they're able to see the same system. So let's say this particular patient came here. We denied the medication because, he was too early. So we denied it. Mm-hmm. He went to another doctor and that doctor was not on cures, but he's still able to prescribe.
Okay.
However, there's kind of like a loophole because certain mom and pop shops don't have that kind of system. So they're not able to see. So they can dispense the medication no matter what. Certain, not all of them, but there's certain that you can. So this particular patient happened to go to a mom and pop shop who did have the cure system and was like, we don't have the medication today, but we're going to have it tomorrow. Can you come back tomorrow? And they called us and be like, hey, did you guys prescribe the medication? We have everything documented. So yes, we prescribe the medication. However, they're not due until so and so. So, at that point, they call the police to make a report. They have to report it because that is considered to be, using it illegally.
Right.
I don't know how it's handled at that point. I don't really know too much about it. But once I don't want to say problem, but once the issue has been raised, they flag the patient. So once they flag the patient, now it's kind of a little bit more harder for the patient to get the medication. And not because we don't want to give it to them, because they're obviously using it how they're not supposed to.
Right.
They're either selling it or overusing it. You can see on the patient themselves, you'll see them act differently depending on the medication that you're giving and the patient, and depending how hard they're pushing to get the medication.
Right.
So you'll be able to see, if it's them that they need it, or is it for an addiction or for something else. And then, unfortunately, I've had friends, no longer friends anymore, but I've had acquaintances now, I'm going to say acquaintances now, who have definitely asked me like, hey, can you prescribe me, this medication, or can you prescribe this medication? As a nurse, you're able to prescribe certain medications,
right?
Certain medications.
Okay.
And, sometimes you cannot, because it's, your license is just not able to give you that kind of medication. My ex-friend, she asked me for certain medication, and it's like, no, like it's, it's kind of hard, and or they ask for certain things. There's some friends who will keep you because you can provide a service.
Yeah.
And, I had friends who asked me for, proof of this, proof of that, and it's like, I can't do that. That's stuff that's altered and stuff that's on record.
Yeah.
I just can't be like, hey, let me just type this up and just, discard it. It doesn't work that way. And then, my particular friend asked me for, I'm not going to say certain things because I don't want to,
sure.
whatever. But yeah, it definitely goes against your code, against, what you stand for.
But nurses are doing it though.
Yeah, there are nurses that do it. I do know that there are nurses that do it. And because there's different loopholes on how to do it. So for me, even though I have the means to do it, I don't do it because I won't feel that that's ethical.
Well, plus, it's not worth your job either.
Plus, it's not worth my job. That's the number one thing. The number one thing is my job, because unfortunately, if I lose my job, who's going to pay for me? The person that I'm providing stuff for is not going to give anything to me.
Right.
So it definitely goes into that effect. But I've come across patients where you can definitely see that they are very,
so
very related to it.
Do they prescribe it to their friends as favors, or do they prescribe it and then sell it? Are they making money off of it?
It depends. It depends. There's some people for example, I usually have one of my actual providers who I ask hey, this is what I'm feeling, or whatever. And do you think that you can prescribe it for me? If you cannot, I will go to see my doctor.
Right.
However, for nurses that work during the day, it's kind of hard because your doctor is open the same time that you're working.
Doctor's always there.
So it just sucks. But, I have been lucky enough, or I have been very close to, providers that they definitely see me as a patient and give me what I need to be treated for what I'm getting treated for.
Sure.
And it definitely comes through to my mom also, I do that too, or my friends, present company included. And so, and you've seen that level, because even though I could prescribe you what you need, I take you to see like, my medical professional doctor or, provider to give you and treat you how you should be treated.
Well, that and I don't take pills anyway. So
yeah. But I mean, it's just a perfect example of like how it is.
So
at least for me, I can't say it for other people.
Right, of course. So how many nurses actually abuse it for their own uses?
Definitely. I know particularly one in particular. However, I don't work in others, so it's hard for me to say. But yes, it does definitely happen. And unfortunately, where we worked, the medications, we are able to walk into the medication closet. However, now it's more sophisticated and everything is logged through the computer, and the computer is the one who releases the medication.
I was going to say, I mean, because medication's tracked, I'm sure it's always been tracked to some degree.
Yes.
How do they go about getting around
this
these meds being hidden and stuff?
So this is where, unfortunately, this happened in county. And in county, remember, we're government funded.
Right.
With that government funding also comes medication that's provided from the county.
Okay.
So the medication, as long as the medication is charged, not charged, because you cannot charge like that kind of medication to a patient. It's supposed to be given for free. Since it was given free to us, we should have been giving it for free to the patients. However, we did not do that. We as the company, not me as like the nurses, we as the company were selling it to the patients when we were not supposed to do that. So this is where it already kind of starts getting a little bit kind of weird. But anyways, I digress. So in these medications, as long as it was charged to a patient, it was considered that it was given to a patient. So the person that I know, or the nurse that I know, would grab like a label from the patient and then just kind of stick it like on the log. And it's like, okay, the patient is the one who got it. Oh. The patients don't ever see the billing, so they don't know any of that.
Okay.
So on that one, because again, it's not through computer, it's not something that's kept like super record of like how it is now, you don't. So it was easy for her to just kind of like grab what she wanted and just kind of put labels, and she would kind of like distinct to like what they were coming for. So it would actually make sense that the medication was prescribed to that particular patient.
So you find a patient that kind of has what you're looking for.
Yeah.
You get the pills to them.
Yes.
Maybe they see them. Maybe they don't.
Yeah,
like
exactly.
You as a nurse, not you, but like the nurse who does it definitely sees the pills, and then he or she is just free to do whatever they want with them.
Yes.
Holy shit.
Yes. So
well, what happens to the patient?
Again, they if they get the medication, if it's the medication that we're supposed to be prescribed, then obviously she would give it to them because it's something that was needed, and it's definitely something that will be trackable because the patient will be like, hey, I didn't get any medication.
Right.
You know what I mean? And then there's some patients who the doctor would be like, you know what, you're okay. Like if you whatever you think, if you think the patient should get it, or if he's really adamant or she adamant that they want something, just go ahead and prescribe something. So this is where the doctors also, I don't want to say the doctors are at fault because they are not. The nurses are the ones who are making the decision.
Well, yeah, that's the big question is like, do the doctors know that this shit's going on?
No. The doctors, once they hand everything off to the nurse should be taking care of it correctly and ethically.
And then the doctor just reads whatever the nurse writes.
Exactly. So this is where, unfortunately, there is trust between the nurses and the providers. However, some nurses do take advantage of it. If you're at county, you don't see the same patients twice.
Right.
It's kind of rare unless it's something that really they don't have insurance and they really need to be treated for. But it's not really like those patients you don't really see like more than twice.
So there are definitely ways a nurse can.
Oh, definitely. It depends. Yeah, it depends on where you're at. Like absolutely, hospitals too. But hospitals are getting more advanced now. Just exactly how we're at my current job. We don't have medication to dispense like that. Ours, it really is just medication for what the patient is being treated for.
Okay.
So, but even for that, it's a computer and you have to put in your credentials before you can even release anything. You have to put in your credentials, the patient's information, what you're going to get out. There's a lot of confirming and doing anything before you even release anything. So it's easier to track.
Well, that's good. What do you do with a nurse who's found to be addicted to stuff and has been doing all those sneaky things? Do you just fire her and be like, fuck you, you're on your own?
So unfortunately, that is the protocol. They just fire them, and unfortunately, they're able to just go to another job and kind of do the same thing there too.
So it doesn't follow it on the record?
It does not.
Nobody makes note of that?
They don't really make notes of that. I mean, they do. However, they don't put it as how you and I would probably write it out to something like, hey, don't hire this person. Like, she's obviously, you know, a narcotic seeker or whatever. No, they just say either like differences or, you know, something to make it kind of nice and tight because they don't want any repercussions to them. It's not to the nurse. Remember, everything is for protecting the company.
Wow. So this nurse who might be a drug addict, might be a drug dealer who's manipulating patients' charts in order to get pills that they want or at this point maybe need.
Yeah.
Get caught, get fired, but then he or she could just go to another hospital because the hospital before is not going to say, hey, we have the narcotics.
Yeah. A thief. They don't want to say that.
Holy shit.
Yeah. Unfortunately, that's not how it is. I don't know. I haven't come across anything like that now, like, in, you know, this far into my career, but yeah, back then I know she was just like go and it was kind of like,
and then she can go anywhere else.
Yeah, she can go anywhere else. Like, I mean, they just kind of like put it like, you know, I don't know. I'm not HR, so I don't know what they do or how they put it, but I'm like, you know, if you're able to get another job somewhere else,
somebody didn't say something.
Yeah,
because in your line of work, if somebody's manipulating charts to get pills, obviously
you're gonna say something that
should show up on a work record somewhere.
Now, like, if you are a bigger organization, it not that it'll be easy because, you know, I have, you know, heard a lot of doctors, nurses, you know, that get fired for either, you know, overdosing patients, and not because they're incompetent, because some people do like that. Mm-hmm. Unfortunately, you know, there have been a lot of, you know, doctors and nurses who, you know, kill patients just because they like to.
Whoa. Time out. What the fuck?
Yeah, absolutely. Yeah, there's been a lot of doctors and a couple of nurses who have been, you know, taken their license taken away because of the same thing.
They kill patients?
Yeah, absolutely. And again, sometimes it could be incompetence, you know, and sometimes it really is because they enjoy it.
Okay, we are going to talk about this for a second. I guess my first question is going to be, how the fuck do they get away with this?
It's definitely getting a little bit more difficult for people to do that. Incompetence sometimes can be a part of it. How, like, for example, okay, it's very close to mine. You know, my ex's grandma was at a very ginormous organization. Like, I mean, worldwide organization. So, she was there and she got overdosed with heparin and she ended up passing away because she was allergic to it. And it's like, when you have allergies, you have, I don't want to say markers because they're not markers, but you have like alerts that tell you, hey, you know what? Patient is allergic to penicillin. Obviously, you're not going to give anything that has penicillin.
Okay, but
you have to find other things.
That's accidental stuff that sounds like it's just part of the job. Sometimes you're going to make the wrong call as a professional, and it is what it is. I make the wrong call in my line of work, something gets broken. You make the wrong call in your line of work, sometimes people die, but that doesn't mean it was in malice.
No, it definitely was not in malice. However, remember, once you have an allergic reaction, it will definitely be documented. So it was documented in the chart that she had the allergic reaction to the heparin. So why was the heparin induced in her body when she was already alerted that she was allergic to the heparin?
You tell me.
No, but that's what I'm saying. It's just, I don't want to say she did it in malice because I don't know who this nurse was. I still don't know who this nurse was. But what I mean is that, you know, even though you have the alerts and you have all this stuff, shouldn't you make a conscious decision into whether you should administer something that the patient is clearly deathly allergic to it? Or is it something that you're choosing to do so because you want to do it?
Jesus fucking Christ. So the very place people go to get care and treatment, sometimes they're purposely killed?
Yes. So I'm going to give you an example.
You got to break this down for me. Like, how the fuck does this happen?
And we went to, and we were there because, you know, we like to go shopping and it's awesome there. Anyway, so we get there and there is a hospital there. And my dad was like, we don't ever come to this hospital. And I was like, why? He's like, this hospital is if you want to die. He's like, because they kill you here. And I'm like, what the hell do you mean they kill you here? He's like, yeah, no, people that come here, they come here to die. He's like, they overdose you. They don't give you any medication. They just kind of let you suffer until you die.
It's not like one of those places like, what's it called?
And it's a hospital. No, it's an actual hospital. This thing is not like a mom and pop shop that looks like a little tiny building. No, This is an actual functioning hospital, like any hospital that you would see. So I'm like, why are people dying here? And then he's like, yeah, no, he's like, we don't ever come here. And I was like, that's horrific. And I was really upset that I can't go this year because I want to go kind of back there and kind of be like, the fuck y'all doing?
Investigate it.
Yeah, like, you know, like I'm a nurse, like, but obviously, you know, different types of nurses, but still, it's makes you wonder, like, why would someone who like obviously lives there, like, knows exactly never to go there because you don't want to die. You're going there to be treated and being helped, not to go get murdered.
So that's different country. Does it happen here?
It does happen here. I haven't actually heard of any new cases as of yet. And only because, again, it's not being reported. Not that it doesn't happen or not because we don't know if it happens. It's just because it has not been reported.
So does that mean it gets reported as just like a normal death?
For example, a 90-year-old comes in, she has like a cough, and then it turns into pneumonia, and then she passes away.
It's like not surprising at all.
It's not surprising, exactly. So it's kind of like, I don't want to say you people pick their targets because I don't know how people work on that. So I don't know what they do or who they choose or why they choose that particular person. But for example, there was a nurse in London who was you know, and he was killing people. They were coming in with lung issues, and then, you know, it would be like, oh, their lungs collapsed or, you know, whatever, and that's how they ended up dying. But he would just dose them up with different types of medications that would not be helpful, that would actually like induce certain things on their lungs, and it would just not be, you know,
but because it was a lung related issue, nobody really asks any questions.
Yeah.
So the type of nurse you're talking about, those angel of death types who are like active murderers.
Yes.
Different category, I would say. That's more like a serial killer thing.
At this point, yes.
But are we talking anything like practicality purposes, like space for the hospital, like this bed's being taken up? Nothing
no,
like that.
not that. No, and nothing that I have ever experienced. No, not at all.
Does some of it potentially have to do with like not liking the patient?
Unfortunately, that there are people that do take a lot of their anger for yes.
Oh,
I'm just gonna say
fucking God.
Yes, and only because, not that I have done it or anything like that, because I have come across a lot of patients who are just assholes, and it's like, why should I be treating you? You're just such a dick, you know. Like, that's on the inside, that's what you're saying, but you're gonna treat them no matter what. But there are nurses that either you can see that they are different with that patient, like they're more like, I don't want to say brutal, but they're a little bit more harder than they probably should. Like, you know, for example, like, you know, you probably clean them with a lot harsher, not chemicals, but harsher, like, instead of like, you know, soap and water or HIPPA cleanse is what we call it, you know, probably alcohol, just to be like, you know, kind of like an extra douche about it.
Fuck.
So it's just, you know, and it's just because like, fuck, you know, like, like whatever. So it just depends.
But does that usually lead to?
No. But it can just cause a lot of pain for the patient that is unnecessary.
No, but I mean, like, the nurse's aggression sometimes maybe give them the wrong medication or don't give them meds, so they kind of just die.
I
mean, have you ever heard or seen anything?
I have heard of like nurses who like purposely not give a particular dose of medication when it's needed, and that's usually what I would say that would cause something like that, because, you know, there are medications that need to be on time.
Right.
They need to be time medications. And, you know, you do get your leeway here and there. You can get either 2 hours or 3 hours, you know, before or after. There's leeways. You know, they give you, like, you have your time specifics. So there are, I don't want to say ways, because there's not ways, but, you know, as a nurse, you were able to tell, like, hey, you know what? It's been like time. Like, I need to go administer my medication. And there's some patients who are adamant, like, hey, you need to give me my medication. And the nurse can choose to be like, hey, it's not time yet. And the patient, and like, let's say, for example, if this is a pain medication, and the patient obviously needs it because, you know, they have pain for certain you know, types. And, you know, the nurse will be like, okay, well, I mean, I can still give you like 15 minutes, let's say, you know, until I can absolutely have to, the medication needs to be in your system. So it's like you like, they're allowing you to be in that kind of pain until they decide to give you the medication. So it just depends. There's some nurses that can be a little bit sadistic. They can, And unfortunately, fortunately, I have not come across any like those scary like types. So that's a blessing for me, because I think I would have not want to be in this field if I came across all the time.
That's a major fucking deal, though.
Oh yeah,
like people are going.
Did you see? God, what was that movie with Linda Blair's mom from The Exorcist, and like her daughter was like super sick. Is it Terms of Endearment?
I don't know.
But anyways, she comes out and she was like upset because her daughter needs to have her medication like at a certain time.
Yeah.
Because I think she could die if she doesn't have it. I can't remember. I don't remember the movie. So anyways, she comes out and she starts yelling at the nurse because she's like, my daughter needs to have the medication.
Okay.
And it's like, you can see all the nurses kind of like brushing them off, like, she's not my patient, like, whatever. And there's nurses, unfortunately, there are nurses that are like, that's not my patient, I'm not touching them. In some instances, I think I would be okay with that, depending on the person or on the reason that of the person. But if it's something that needs to be like for example, like that medication, it needs to be the nurse whoever started the medication, because you can miss dose, you can overdose, you can
fuck it
underdose,
up, yeah.
like you could literally mess it up. So when it's something like that, as a nurse, you don't say it's not my job. Obviously, be like, hey, I'm gonna get the nurse who's starting the medication. I'm gonna have her come in and do the medication.
Right.
But in the movie, you see like all the nurses kind of just blowing her off, and it's like she's getting upset because her daughter's gonna potentially die if she doesn't get the medication.
Yeah.
So there's certain instances, there's nurses that hand off like certain things to other nurses because they don't like them, or it's too hard, or whatever the case may be.
But
so,
to your knowledge, nothing is like coordinated with the doctors and nurse to like.
Oh no.
Okay.
No. I've never ever even heard of that before.
Okay, good. I mean, it's still kind of a major fucking deal, though, that this nurse might be mad at you.
Yeah.
And because they're mad at you, they're going to not give you your meds on time.
Yeah.
Or they're going to make your experience a little more uncomfortable. I mean, somebody could potentially die over that.
Oh, yeah, absolutely. Absolutely. Not only that, you do, induce a lot of unnecessary trauma that you don't need to, especially like for, like just anything, and like social and like mental. It's just, it really is. It's a really bad just experience for the patient, not for the nurse involved. Honestly, I feel like, if you're doing that, and you continue to do it cautiously or unconsciously, like you obviously don't care.
Right.
It's just like, you're whatever about it, or it's just, so to you, it's not going to give a shit, like whether the patient suffers or not. But to the patient, it's like you give the rest of the nurses a bad rap. For example, for moms who like tell the kids, I'm going to bring the nurse to give you a shot.
Yeah.
You're already setting me up for failure for
sure.
like everything. And it's like, I'm just here to just put a Band-Aid on you. Like, I'm not even here for anything. And it's like, you use us as like, kind of like a boogeyman, kind of sort of like a placeholder. So when they come in to see us for actual things, like they're scared of you. And it's like, it's hard for you to try to take care of the patient.
Well, I don't think this is going to help none. What about like in-home care stuff, like assisted living and stuff like that?
Yes.
Do you have any knowledge of that?
Yes, I do. I did home health care for a year.
So these are more elderly patients.
They are elderly patients.
They are. And halfway on their way out.
Yeah.
Anyway, does it work any differently there? Is there a lot of abuse that happens there? Is a lot of pill mixing that goes on there? It
does, but not because of the nurse. It really is. It could really be the patient, and only because they are older and they live by themselves. They can't really kind of keep track of their own things, so it just makes it for themselves. They themselves kind of do that
because I heard from another person I used to know who was a nurse that the nurses there, in their experience, they would get mad at a person for being disagreeable, and then they would either not change them, or they would give them higher doses of certain pills that
so they can sleep, and
so that
stuff
they
like
would
that.
sleep, and then sometimes it results in the patient's death. And because they're old or they already had heart problems, and they gave them pills that give you more heart problems, nobody asks.
Yes, absolutely. And then
this happens.
It does happen, unfortunately.
Jesus
This is
Christ.
where I feel home health is a little bit more dangerous, and only because you don't really keep track of a lot of things.
Well, you could kill someone just because you have
because you have a really bad experience with them, or you just feel that they're annoyance, or whatever. But I feel like those kind of nurses, like, you kind of have to know what you're getting into beforehand, before you get there.
Those are some terrible fucking nurses.
They are. And I did home health, and the patients that I had for my home health, they were amazing. But then again, there are elderly patients, and you know how much I love older people. They're so cute. But anyways, yeah, no, I did come across one where the son was just an absolute dream. Like, he was amazing. The patient was amazing. Like, he was great. And he was my patient for like 6 months until he passed. He didn't have any medication. We would never administer medication. Like, he was one of those lucky, like, people who didn't have to have meds. He really just pretty much wanted me there just to make sure, because he did have like a cut on his leg. So I was just kind of there to dress it, and then I just would stay behind just because he was alone, and I would just kind of stay there just to kind of like talk and keep conversation with him. But he was my patient for a little while, and he ended up passing because he was already 98.
Right.
Like, so he was already like older, and he was amazing though, and his son was amazing. He like always took care of him. Like, I mean, he honestly was like one of my favorite patients. But I did have one where the daughter was, I don't want to say she was abusive, because I don't know, like, what would happen there.
Yeah.
But I would definitely see a lot of different changes in my patient. And that's where you normally see if there's something, wrong or abnormal.
But that was the daughter doing it, though.
That was the daughter doing it, though. Yeah. But like, she would be like very, very, I think she hit her once. I think the patient told me that she hit her once, or she like pushed her once. It was like something like that. And it's, for me, like, I love my mom. Like, that girl is, she's amazing. But yeah, like, I would not be able to do that to my mom. So it's really upsetting when you get to see it on that end. And, I had to report it to the company that I was working for. And I asked to be taken out of the assignment, because it's sad. It's really sad to see, because it's like, they are defenseless, like, and they really don't they just want your affection. And when you are kind of providing them just kind of like pain and suffering, it's just kind of like, it's really sad.
That does suck.
And I wish I would have stayed a little bit behind just to see how it kind of like ended. And then it was just too hard for me to stay in that point.
I can imagine so.
Be sure to tune in next week for the conclusion of this conversation. We have many more topics that we will be covering, and I promise you will not want to miss it. Also, in the next week or so, tune in for a very special announcement from yours truly regarding the future of this show and its accessibility beyond SoundCloud in the very near future. We'll see you next week.